Beyond Blue says the research was set up after the organisation identified what is said was a lack of knowledge of the prevalence of post-traumatic stress disorder among police and emergency service workers. Nick Arvanites is the head of workplace research and resources at Beyond Blue and is directly involved with the National Mental Health and Wellbeing of Police and Emergency Service study. He says there is still a lot that is unknown about mental illness within police and emergency services.
There's not a huge amount in terms of research, particularly with a national focus. I think what we know is that police and emergency services are in a unique situation where they're more likely to be exposed to potentially traumatic events on a regular basis, and we know that they are clearly, that exposure to trauma is a significant risk factor for not just PTSD, but also depression and anxiety conditions.
The first stage, already completed, is a qualitative study of personal experiences of police and emergency service workers and their families. The second stage is due to be concluded in September of this year and will survey personnel nationally to determine the prevalence of a range of mental health conditions, including PTSD. Mr. Arvanites says the study hopes to identify some of the contributing factors of mental health problems within the sector.
But we also know from other research that depression and anxiety are also common outcomes of exposure to trauma. We know that there are other risk factors that police and emergency services workers face in the workplace beyond exposure to trauma. There's some research that suggests common workplace stressors such as lack of management support, poor communication, poor consultation can actually have a greater impact on the mental health of police and emergency services workers. So the aim of this research will be to get a real accurate sense of the prevalence of mental health conditions, what are perhaps the contributing factors, which groups within the police and emergency services may be at greater risk, and then based on all that information, identify those strategies and solutions that are actually going to help.
Melbourne man John Octoloni served over 20 years with Victoria Police before being diagnosed with PTSD in November 2014. He says he experienced symptoms of fatigue and lack of motivation and says he was unable to complete his work at a high standard. Mr. Octoloni says he should have spoken to his colleagues about what he was going through.
For my personal situation, I think my work could have been a lot more supportive. At the same time, they probably weren't fully aware of what I was going through, as I wouldn't necessarily talk about it. I think my work could have been a lot more supportive though, and they were probably quick to either want to push me out the door or put me on a performance enhancement program without really knowing what I was going through. And I'm a little bit bitter that I was treated in a way that I was, but at the same time I could certainly say that a lot of it was my fault by not necessarily communicating. So the support networks are there, but you've got to ask for them, and you certainly have to make it known that you aren't in a good place.
Mr. Octoloni says he received counselling in the lead up to and after his diagnosis and subsequently retired from the force. He says seeking help was the best thing he ever did.
Relief to know that I've gone through something as serious as what I did, being depression and having post-traumatic stress, and hearing it from someone else who's had similar things happen to them at their work, but doing the same job, obviously. It was relief to hear that I wasn't alone and that there are other people out there who have gone through what I have, and know that they're there to talk and that you're all there to help each other through it.
Beyond Blue says the police and emergency service workforce has been a priority for the organisation for several years. The study it is undertaking also aims to recognise solutions that could help improve the mental health of workers nationally. Mr. Arvanites says that goal cannot be achieved without collaboration.
We see the real value in the research in working closely with police and emergency services agencies. It's not going to be a success if Beyond Blue in isolation develops a range of strategies and solutions. So The other key group that we are working closely with, which I probably didn't mention, is the family members of police emergency services personnel who are obviously affected indirectly and directly through the work of their partners and family members. So the key point is that we need to work collaboratively to address this issue, and we need to make sure that those strategies and solutions are actually going to sort of meet the needs of police emergency services agencies and also their frontline staff.